Thyroid issues are much more common than you think, and many people who have thyroid issues don't know it. They have symptoms, but they don't know that their symptoms are caused by a thyroid problem. So, what are the main symptoms of hypothyroidism? Say the primary one is fatigue, especially morning fatigue, and feeling cold hands and feet, having sluggish bowels and tendency toward constipation, dry skin, dry hair, hair loss, and then poor memory or just kind of diminished cognitive function and a tendency toward anxiety and depression. So, if you have any of these things, it's a really good idea to get your thyroid tested. And testing the thyroid is usually done, in my opinion, in an insufficient way in Western medicine. So typically, if someone has some question about their thyroid, they'll go to a doctor and just have their thyroid stimulating hormone level checked, TSH. That is the pituitary hormone that stimulates the thyroid gland, and it will rise up if the thyroid is weak in most circumstances. But sometimes someone can have a normal TSH, but if you look at the individual thyroid hormones, T3 and T4, they're not converting the inactive hormone T4 into the active hormone T3 efficiently. And so the T3 levels are low, and they can have a normal TSH and still be suffering from an active thyroid deficiency. So when someone comes to me with symptoms of hypothyroidism, I check a TSH, a free T3, free T4, total T3, and autoantibodies against the thyroid. So what causes hypothyroidism? Well, I would say half the time it's genetic, a genetic tendency, and half the time it's an autoimmune process. So Hashimoto's thyroiditis is where your body starts to recognize the proteins on the surface of your thyroid as foreign invaders, and your immune system mounts an immune reaction to the thyroid. And you can measure the autoantibodies in the blood. Now, looking a step below that, what causes Hashimoto's? I would say the majority of the time it's eating gluten. So the vast majority of people with autoimmune thyroiditis or Hashimoto's thyroiditis have an allergy to gluten. They're unaware of that. They're continuing to eat it. And the gluten allergy, the antibodies the immune system makes against gluten, cross-react with the thyroid proteins. So the allergy to gluten induces an autoimmune reaction against the thyroid. There are other causes of Hashimoto's thyroiditis. So mercury draining from amalgam fillings in the mouth can drain down into the lymphatics and tag the thyroid and render the proteins a little bit different looking to the immune system, and that can promote an autoimmune reaction. And then occasionally infections can cause the autoimmune process, viral infections and sometimes bacterial infections. So again, if you have an autoimmune disease of any kind, including autoimmune thyroiditis, you can often get to the root of what caused it in the first place and work to eliminate that triggering factor, balance the adrenal hormones, and that tends to modulate the immune system, and you can often get over autoimmune thyroiditis. And whether or not you need to be on thyroid going forward really depends on how extensive was your disease before you figured it out and got it under control, and how much of the thyroid was destroyed. So, most often a person can really do well with the amount of thyroid that's left over. So not everyone who has Hashimoto's has to be on thyroid for the rest of their life. Now, autoimmune, just regular kind of hereditary run-of-the-mill hypothyroidism is hit or miss. I would say if you have that and you have insufficient levels of thyroid hormones, you're having symptoms to match all of that, oftentimes taking thyroid is the best way to go. I have not had the greatest luck with herbs that are supposed to enhance thyroid function or iodine, for example. I've seen a lot of bad reactions to iodine in my practice over the years, not necessarily from my prescription of iodine, but from people taking it on their own, prescribed by other practitioners. Iodine is tricky to work with because it can help probably the majority of the time, but it also has the potential of causing hyperthyroidism in some individuals and worsening hypothyroidism in other individuals. So you have to be very careful with iodine supplementation. But anyway, So what you can do if you have hypothyroidism is ask to have a complete thyroid panel that I discussed tested, and then consider supplementing thyroid hormone if necessary. And there are many options there. And I'm sure if you see a doctor that's skilled in bioidentical hormone replacement, they will lay those out for you. Natural desiccated thyroid versus synthetic thyroid that's bioidentical still in nature are the ways to go.